bless this food and nourishment of our bodies. We ask these things, Father, in Jesus' name. Amen.
Flag salute. Pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
You may be seated because I don't see Patty Beth in the room. Stand up, sit down.
Who's Sergeant at Arms? We need a fine. Let's go.
Kathy, will you add that to my tab, please? A running tab for these types of offenses.
That's right.
It was your birthday.
Yes, and it's we're continuing with the birthday theme. Thank you for getting a program on aging for me today. So in honor of that, it took me a bit that I found a song that I thought would be appropriate for today. Anybody that's very young will not know this song, but the rest of us will. Here we go. The old gray mare, she ain't what she used to be, ain't what she used to be, ain't what she used to be. The old gray mare, she ain't what she used to be, many long years ago. Many long years ago, many long years ago. The old gray mare, she ain't what she used to be, many long years ago. This is so funny. Did you see whose faces and mouths were moving and some were like, what kind of song is this? Give yourself a round of applause.
Our Sergeant at Arms is Judy Mack, and I don't know if we can top that, but I'm going to let you give it a shot.
Well, our Rotarian of the day today is Serena Nelson. So I think we can credit her account. I don't think we need to debit her account for that charge.
Thank you, Russell.
So I just found out that I was Sergeant at Arms like 5 minutes ago. So we're going to do Lobster Fest trivia. Does anybody know who the benefactor was of our very first Lobster Fest? I'm going to go with who?
YMCA.
YMCA was the benefactor of our first Lobster Fest. Does anybody know how much they received? Pauline? $35,000 because we had no idea how much money we were going to raise. That was our very first one. Our next one is coming up May 30th in the Wolf Creek Expo. And I expect to see most of you people in chairs. If you have tickets, we're lucky enough to get tickets. And if you did not get a ticket, I want to see you there working because we need workers. Now, today our topic is the art of aging, right? Some of us are looking rather tired. Everybody that has been working on Lobster Fest endlessly for the last 6-7 weeks, stand up. Stand up, I know your knees still work. Okay. We have the alcohol man over here, Jim Corbett, Jim Reynolds, they're very important people. Serena is spearheading everything. Kathy Donaldson is handling everything that we don't know how to handle, which is a lot. Diane Hampton, Diane stand up. Diane is doing all the silent auction. Is Linda here? Linda Rigby? Martha Thompson, stand up. She's been doing a lot. If she walks in your door in town, beware, she's asking for something for free. Jonna Shirley is handling all the food. What a headache. She's doing a great job. And Jason Evans is also involved. Suzanne is doing all the ticket and sales. I'm doing whatever Suzanne tells me to do. So, and I want to thank our sponsor for Lobster Fest since the very beginning, the very first one. Our title sponsor has been Bank of Grand Lakes. Stand up. And Sarah Wilhelm. And also we would like to say, Ed Townsend, thank you for believing in Grove Rotary and supporting Lobster Fest over the years. And so those people that have missed the meeting the last couple of weeks ago, our fines have increased thanks to inflation. Our financial analyst over here, Charlie Wallace, gave us a whole line about how much the fines were going to go up and why, and we don't care. But put $2 in the bucket from now on, okay? Thank you, everybody.
Don't forget our cooking team, Zach Bechtel, Jim Matthews, Grove Football, thanks Pat Dodson by getting those volunteers there for us. So it just continues on and on and on. Now, for Rotarian of the day would be me. So today, I would like to take a moment to express something that truly comes from the heart. The gratitude about my Grove Rotary Club. Being part of this Rotary is so much more than attending meetings or participating in events. It's about being surrounded by people who believe in something bigger than themselves. It's about a shared commitment to service above self. A principle that we don't just say, but live out in our communities every single day. I'm deeply thankful for the friendships I've built here, friendships rooted in compassion, dedication, and a genuine desire to make a difference. Each of you inspire me in your own unique way, whether through your leadership, your kindness, or your willingness to step up whenever help is needed. Rotary has given me opportunities not just to serve, but to grow, to become more aware, more involved, and more connected to the needs of others. Together, we've worked on projects that leave a lasting impact locally and globally, and that's something truly special to be part of. So today, Christy Wallace, Charlie Wallace, Jonna, Carol LaRue, everybody in this building, I simply want to say thank you. Kathy Donaldson, Diane Hampton, thank you for your fellowship, your passion, and your commitment. I'm proud to stand beside you as a fellow Rotarian, and I'm grateful for the difference we continue to make together. Judy, Suzanne, thank you. And we're back. No students of the month, since we're graduating May 22nd, so congratulations, Pat Dodson. Our caterer today is Mulligan's. Thank them for their wonderful job on our taco bar. Special guest was Carol LaRue, Suzanne Lovell. Great to have you here today. Our new not potential member, she turned her application in, Sarah Wilhelm is here with Ben Hampton. Great to have Sarah. And with Emily Case is Wanda Neal. And then Michael Addington, you're no longer a guest because you're our assistant coach. So here we are. Anyway. Now, we're going to have some new member introductions with Diane. Emily Case is getting her blue badge today, so if you guys will come forward, please. Good afternoon. Emily's a hard one to catch, so she's here today, so we're going to give her a blue badge where she can just be full-blown Rotary now. I'm excited. And she's with Farrah, and Farrah keeps her very busy on the road a lot, I think. But anyway, the committee that she wants to be involved in others, but one of the committees, Clint, you need a nabber, she can drive a golf cart for a fishing tournament. She's willing to... Oh, she's done it already. So anyway, at this time I want to present Emily her blue badge. If there's any special announcements, if you will make your way to the stage. David Sloan, Flag Committee, I know what's coming.
On Saturday morning, this coming Saturday, 9 a.m., we'll meet at the Buzzard Cemetery Storage Building. We're going to be putting up our flags along Highway 59 from Sailboat Bridge all the way to Honey Creek Bridge. It's something on the order of 210 flags we'll be putting up. Also this year, because we've tried to get our flags more in line with the usual flag protocol, we've had to rearrange our brackets, so we've got some extra work that will be done that's not, hopefully we only have to do it one time. So anyway, we need all of the able-bodied members that we can can get there. We have a flag committee, but we have a lot of people in the flag committee who can't get off the ground. So we need people who can climb ladders and/or use a pickup to access the brackets that we have on the light poles. Like I said, we need anybody who's willing to help. We'll meet at 9 a.m. Saturday morning. Thank you.
Round of applause for the great collection. Anyone else? Well, if not, Christy is going to be introducing today's program. Ashley Thomas, who's also my traveling compadre. We got to watch the Dallas Cowboys beat the Kansas City Chiefs last year. We bid on the Crosslands package, and it was phenomenal, might I add. So that's coming up soon and will be in your program for Lobster Fest. So.
To see that. I gotta say, I have helped with the flags before, and props to that committee. If I were to be in town, I would 100% be there. It is just so much work going up and down the ladders and in the back of the trucks. I'm sure there's, like, every OSHA thing is being broken with the way we install these flags, but when you see how much it means to people in town, usually when they go up, you'll start seeing Facebook posts of people or people that are, coming in town for a weekend visit. They're just so inspired by it. So thank you to everybody who does that. Well, I'm excited to introduce you to two dear friends of mine today. I have worked with these girls for years. In fact, when they decided to step away from their jobs at the hospital, my phone was blowing up from their patients being so upset. So luckily they stayed in Grove. They've just changed their focus a little bit. I can tell you, I know firsthand how dedicated they are to their patients and to the field of medicine. Both of them are just constant researchers. Like, if there's a way, they are going to research it and find it. And I would see this when they had, their practice at the hospital. They get some patient with some unusual thing, and they're calling physicians, they're researching, they're doing everything they can to find answers for their patients. And as somebody who loves anti-aging, I love that they're kind of extending that into this new field. They really are focused on understanding the aging process and providing patients with the education and tools necessary to improve longevity, achieve vitality, and enhance their natural beauty. Ashley Thomas is a board-certified nurse practitioner with 7 years of direct care patient experience and more than 11 years in nursing. She attended Graceland University for her master's in nursing and earned her bachelor in nursing from the University of Oklahoma. Tessa Longan is also board certified as a women's health practitioner. Tessa has spent 19 years in healthcare, with the last 10 as a nurse practitioner with Grand Lake OB-GYN. Tessa received her master's in nursing from the University of Missouri, Kansas City, and her BS in nursing from the University of Oklahoma. Please help me welcome Tessa Longan and Ashley Thomas.
Okay, so a lot of faces look familiar, a lot of faces don't. But I will first off say, Tess and I are excited to be here, anxious to be here, and I'm not a public speaker, so be nice. Tessa and I thought about what we wanted to focus on, and I think we want to talk about hormone replacement therapy. So we know that it gets a bad rep, we know that it's an individualized thing, we also know that safety is our main concern, right? And monitoring everybody. So if you don't know more about it, you're going to feel educated today. So hormones begin declining in our 30s. Women experience fluctuations in estrogen and progesterone, while men gradually lose testosterone. Symptoms like fatigue, weight gain, brain fog, and low libido are often dismissed, but frequently hormonal related. Hormone replacement therapy restores hormones to optimal levels. If it is individualized, monitored, and designed to bring the body back into balance, not excess. Women experience improved energy, mental clarity, mood stability, sleep, metabolism, sexual health, and protection of bone and cardiovascular health. Men benefit from increased energy, muscle mass, fat reduction, improved cognition, mood, confidence, and enhanced sexual health. So Tessa and I at Art Med Spa, we have different modalities of hormone replacement therapy, right? There's topicals that we can apply, there's patches, there's injectables, and there's pellets. And hormone replacement therapy with us is not just on one modality, so you get to pick, right? Because it's not a one-size-fits-all. Candidates include symptomatic men and women with confirmed hormonal imbalance, and treatment is based on symptoms, labs, and clinical evaluation. Hormones are a bigger part of wellness strategy, including nutrition, exercise, sleep, and stress management. On the anti-aging benefits of it, and Tessa's going to probably be more detailed with this, it does overlap with men and women in some of it, but we're going to talk about skin health and appearance, muscle mass, body composition, bone density, cognitive function, energy and vitality, cardiovascular health, sexual health and libido, mood and emotional well-being. And I again want to point out that it's very important to make sure that hormones treatment is being considered individualized and monitored by a well-qualified healthcare provider. Treatments and decisions are based on symptoms, laboratory testing, and overall health status.
Can you hear me okay? Yeah. Okay, all right. So when Christy introduced me, she introduced me as a women's health nurse practitioner, so it's a little bit different than Ashley, where she is family nurse practitioner. So my main focus for most of my career has been on women, but I also get to care for men's sexual and reproductive health as well, but that's about it for men. So I really wanted, while the guys are super important, hormone replacement therapy is so important for men too. They've really been served pretty well in this area. I feel like a little better than women have been, so I'm just really gonna focus on the women here for a little bit, just because I think we need a little more awareness around the effects of decline of hormones in women for aging and supporting longevity. So for women, this hormonal change really starts to happen sometimes late 30s, but definitely 40s and 50s. We have women come to us all the time that tell us, I just don't feel like myself anymore. I don't have the energy I used to have. I don't have the motivation I used to have. My sleep is terrible. I work out, but I no longer see changes in my muscle definition. It's harder to work out. It's harder to recover. And they notice things like sexual changes that can start to affect relationships. And so sometimes these are things that we don't all want to talk about. But as long as, if we live long enough, we're all going to experience it. So I think it's important. So on top of just the physical things that is so easy to notice as we're going through that change, there are things under the surface that are even more important, that are being affected by a decline in hormones, and that's cardiovascular health. So cardiovascular disease is #1 cause of death for women in the United States. There's more death related to that than all cancers combined. And the evidence is showing us that hormone replacement therapy or hormone support earlier in that transition of menopause has a lot of cardiovascular protection built in. It may not be as much if someone has gone through menopause and then decide not to start hormone replacement for 10 years. There can still be some benefits, but it may not be the cardiovascular benefits. Diabetes and metabolic disease rises. We know that with hormonal changes, we can become more insulin resistant, and that can lead to increased risk of diabetes, which can also increase our risk for Alzheimer's and dementia. And so again, this is one of those things that have been found, if we support those hormones earlier in that transition, that we might decrease risk for cognitive decline in women too. Probably we've all heard of this, but osteoporosis, so we start to lose bones, some bone mass as we get older. Men do this too, women do it at just a lot higher rate than men. And so hormones can be helpful for that. And this is something that's maybe a little more unique to the women, but there's a condition called genitourinary syndrome of menopause. So things that women might notice are urinary frequency, burning or irritation, recurrent urinary tract tract infections, leaking and getting up at night so that it impacts their sleep. And I think I left out in the very beginning, one of the big ones are hot flashes and night sweats, which also impact sleep quality a lot. So anyway, when we talk about hormones in women, we have, the three main ones. We have, as far as like sexual hormones, there are estrogen, progesterone, and testosterone. So all start to decline in our 30s and 40s. As far as estrogen, I'll just kind of do a quick run through of kind of what they're responsible for. That it reduces hot flashes and night sweats, supports skin hydration, it can improve mood, mental clarity, sleep, because we have less hot flashes, joint discomfort, bone density, insulin sensitivity, and like we talked, cardiovascular health when started early. Progesterone is our hormone that kind of helps us feel calm, so it can promote better quality sleep, helping us stay asleep so we're not waking up at 2 or 4 in the morning and can't get back to sleep with our anxious thoughts. Just feeling calmer in general for younger women can help with symptoms of PMS. And then testosterone, this is one that I think gets overlooked in women. When we are comparing, obviously estrogen is our dominant hormone and testosterone, but when you just look at women, we actually have, when we compare the units, we actually have more testosterone than estrogen, which I always find very interesting. So testosterone is responsible for, it can help with libido, it helps with our motivation, it's the one that can really help with like mental clarity, decreasing that brain fog that we so often get. It also supports bone density and improves sexual function. So anyway, I just wanted to kind of give a brief overview of that, because I'm sure, again, any women out there probably experience that, and even the men, if this doesn't all apply to you, you have a woman in your life that could probably benefit. So anyway, very impactful on quality of life. And I think Ashley kind of touched on, we have different modalities. Same thing is true for women. We like to use bioidentical hormones. So these are those hormones that are molecularly similar to the hormones that our own ovaries make. And so we monitor labs. We choose what the best option is for that particular patient. And so anyway, Ashley and I just felt like the hormones were a really important place to start on anti-aging longevity. It's only a piece of the puzzle, but you could probably do talks for for several weeks on the different layers that can promote longevity, but we just felt like the hormone piece was one of the big ones. So, any questions? Yes, sir.
Do most of your patients come as a doctor referral?
We have some that come, like, actually we're really fortunate.
Microphone.
I feel like my voice carries.
We're all wearing hearing aids.
I think you should turn your hearing aids off. No, we have a lot of physicians and providers in this area that do refer their patients to us. In our study, we don't take insurance, right? When a man chooses testosterone injectables, we often see that insurance covers that. With women, I haven't seen testosterone covered as far as an injectable or a pellet, but they do cover typically our topicals and our patches, things like that, or progesterone as a capsule.
Well, I guess my question was really, people can just walk off the street and make an appointment.
That's correct. And I guarantee you, if you've been around Dr. Becca for very long, I know that you've heard this. If you don't use it, you lose it. If you sit, you rest. He's a fine example at the gym. I see him on the regular with a couple other people in here. So it's not going to be a fix-all, cure-all. But if we're putting in the effort and we're doing our dietary and lifestyle, this is the icing on the top, right? And I don't think that if you're in your late 70s, we're going to make you feel 20 again. But I think we can definitely give you a little bit more energy, and I think the effort that you're putting in, you would notice more.
Hey, I'm just shooting to feel like 50 again. So, I mean, what is it, if you're interested in this, what's the best thing to do? Make an appointment and come in and get like a blood test, or what's the first step?
Yes, you're absolutely correct. So we do what's called like a hormone replacement consultation. And so you would just schedule that. You come in and we kind of go over your menopausal history, your health history, and then we will typically do like a panel of labs or order a panel of labs at that time that looks at multiple other things, because sometimes some different symptoms can be thyroid related or vitamin deficiency. So we want to look at all of those things and not just focus on the hormones. So we do that, and labs typically take about a full week to get back. So then we schedule a follow-up to go over labs with the patient, and then from there we create a plan of care.
And a lot of people, they are great candidates for it, but not everybody is. So we definitely look at the risks versus the benefits, and we individualize this. I think another thing that I hear a lot of people say is, once I start this, can I stop, or am I on this the rest of my life? No, you can stop anytime, and we can change modalities. You may start with a topical and move into maybe an injectable, but you're not stuck with something just because you start with that.
Is there a typical age at when you should start monitoring for hormones, irregardless of symptoms?
So that's a good question. It's also probably a little bit controversial depending on what you're reading and who you're asking, and that's the great thing is we can all have different opinions on that. But I think, I think in family practice, what I would typically say when I was in that setting is, if I draw labs in a 20-year-old man versus maybe a 65-year-old man and older, we know, and a woman too for that matter, somebody in their 30s versus maybe in their 70s, or they've had a hysterectomy where we've removed ovaries and stuff, their levels are going to show in the natural aging process they decline, right? Our goal is to get you back to an optimal level. Your level may not be the same as somebody like me or Dr. Thomas. So we take that as an individual approach. But I think you can ask at any time. We have men in their 30s who have low teeth.
So you brought up the word risk. What would be the risk?
So I'll kind of talk on the women's side. So probably everyone in here remembers the release of the Women's Health Initiative, those results back in 2002 when we all became super scared of hormone replacement therapy. And so a lot of women went off of their hormones, and it's been very scary for patients as well as providers even to really have the hormone conversation. And so fortunately what we're learning is that there's a lot less risk involved than what that study portrayed. We go into the details a little bit more, but those are synthetic hormones used in women that were average age of 65, so well past that 10-year mark in their menopause journey. And so they did see increased, not even statistically significant, but some increased risk of breast cancer in women who had to take progesterone with estrogen after 5 years. They were also doing an oral estrogen, which we now know orally goes through the liver, increases potential for heart attacks, blood clots, strokes, and so you'll find us trying to always avoid oral estrogen if we can. It's not the end of the world if we have to use it for the right person with other low risk factors. But those are kind of the things that scared us at first, but now we have different modalities. Breast cancer, now estrogen has actually been, estradiol, which is our bioidentical estrogen, has actually been shown to be protective in the breast. We think that testosterone might be protective in the breast too. If someone has a uterus and they're on estrogen, they do need to take progesterone. That's what protects the lining of the uterus. So if we just gave you estrogen, then there can be an increased risk of uterine cancer or precancer, and so we would never want to cause that. But for the most part, I don't know if I've answered your question clearly, but the risks are a lot less than what we used to assume.
Some of us here are probably on Medicare, and our annual physical, they give us blood tests all the time. What do you test differently when you do the testing than what we get in our blood test when we do our Medicare physical?
So on that, we add, on men, we add a PSA or prostate-specific antigen, and we're adding a sex hormone binding globulin. We're looking at follicle stimulating hormone, estradiol, free total testosterone,
Vitamin B, B12, vitamin D. Probably, I don't know the department, routine thyroid screening.
We're adding that in there just because, again, it's really important that you consult with your primary care provider too. We don't want it to be we're treating over here. We think it's definitely a team type of deal, so we don't want you not telling Dr. Bechtel that you're coming over to have clients. We consult with our providers too, and if there's any thing that we can do to make sure we're not overlapping or double dipping on lab, we want to do that. We always provide a copy of those lab results for you to take to your primary care provider too. And often, they'll say, hey, can I see if my primary care provider will order those? And we usually send what we typically like to have drawn, and I've yet to have a provider not draw them for that patient.
On the safety issue, do you want to address the major reversal in FDA black box warnings for estrogen that came out this year? I know the first study that you previewed the question was back when I was in residency. So for 27 years, we had an entire group of postmenopausal women who were afraid to take hormones. Never made sense to me. You have estrogen running through your veins for 50 years, and all of a sudden you get menopause, and somehow it causes cancer or a problem. That just never made sense. But we do know that they've completely reversed that, and they've taken that warning off.
In the last 6 months, yeah, this is exciting.
So are you talking about because I'm thinking of the testosterone black box warning, but I guess maybe clarify to me on the estrogen one.
Yeah, it's the estrogen for women. They came back and completely took the black box warning off of women taking estrogen at the postmenopausal center.
Okay.
And for 27 years, there was a warning on there that caused women not to take it forward.
Yes, okay, yes. I'm sorry, I do recall that now. And then also they have taken off the cardiovascular risk from testosterone replacement therapy probably in the last 6 months to a year as well.
That's what I didn't. I've always told that. The American Cardiology always kind of had a warning about men taking testosterone.
They did, yeah, that was very recent.
So they took that off.
And it's exciting. I feel like even men, when we talk about your prostate health, right? And again, I'm married to a man that's 61, and so we know that at this point he would love me announcing this to everybody. He's got a large prostate, but I don't think there's probably a man in here that doesn't have probably an enlarged prostate, right? We live long enough, and so I used to be one of those providers that also thought, oh my gosh, we're going to get testosterone replacement, and these men are going to get all prostate cancer, and that's actually not true. So your greatest, like when we're seeing the diagnosis of prostate cancer in men, it's not when you have the highest testosterone, right? It's when you have you're at your lowest. So do I think that testosterone can sometimes make somebody with a large prostate have some more additional symptoms? Yes. But there's also medications that can help with that too. And again, our primary care providers are great, and neurologists that help you with that. Yes, sir.
Yeah, I'm seeing more and more where AI is being used in the medical field. Do you guys use any of that profiling the diagnosis of patient's needs?
I do think, this app, Dr. Rutter actually showed us an app.
There is an app that is really actually fantastic. The one I'm familiar with is Open Evidence. And so it is very nice that you can go in and put in a patient's, what their complaints are, maybe what their medication list is, what their significant health history is, and it gives you, it will help with diagnosing and treatment and provides the studies and the guidelines and everything to support its answers. So that is very, very beneficial.
And then also, again, having an entire community of providers that stand behind us and being able to pick up the phone and reach out to them and collaborate with care, way better than AI.
Well, I want to talk about collagen because, of course, there are probably other women in this room that, we're trying to preserve what we have. Is taking, I know, right? It's with me here. Like, what can we do to keep looking young? Is taking the collagen, the collagen peptide, and I mix it in with my coffee or whatever, is that really going to help the collagen in my face and help my aging,
yes.
anti-aging? Is there an anti-aging benefit?
Yes, absolutely, and it's also good for our gut health, but it's not a replacement for nutrition, and nutrition is probably going to be your best bet for that, right? Time plays against us on the collagen production. And we have some radio frequency and microneedling and things that we can do that you can't outrun a bad diet and a bad lifestyle. So you can take all the collagen you want, but if we're not hitting our protein goal and we're not in the gym working out and we're not preserving our bone and muscles, then collagen is just going to be found in your stool.
But we do in fact start making less of it as we get older. So I think the replacement is good, but sometimes a little stimulation is also good.
So what is like kind of your top nutrition tips?
I think that this one is a loaded question. Because I think if there's a nutrition or a dietitian, then they probably have a better answer on this. But I feel like the vast majority of us, we hold excess weight or we're not burning the calories that we need because we're not getting enough lean protein and we're eating more carbs and fat than we need to. So I would definitely say our protein and our water.
Yeah, I agree, and fiber.
So let's just say I've tried everything. And nothing's worked. And I'm really 40, but I look much older. And I know you guys do other things besides hormone replacements and stuff like that. What can you do with this? What can you do with this? What other services do you guys have that might help this? Not this. I know you can't do anything about that. This and this.
So we do some aesthetic treatments too. So we do neurotoxin. So that is just injectables into the face that helps to relax the muscles, that causes to create wrinkles over time with our expressions. That's something that can be done every 3 to 4 months. We do some fillers. We don't do a lot of those are hyaluronic acids, or they're kind of a gel that can go and fill in some of the voids, the places that we lose fat volume in our face. I would say we probably do a little bit more of a product called Sculptra, and so what it is it's a biostimulator, which causes you to increase your own collagen over time. Usually 3 to 6 months, like in those areas where we start to lose volume, usually like cheek, temple, kind of around the mouth area. Do you want to talk about our others? No.
If you have unwanted dark hair, black, brown, not red, not blonde, not silver, not gray, not sparkly, we have laser hair removal for that. So sometimes getting rid of some hair can hide your age a little bit. And then we have something called IPL, and it's a laser, and its job is to target red and brown pigment. So it feels like a warm rubber band snap, and over the next 2 weeks, you start seeing your pigment speckle up to the surface. I call it chocolate chipping or coffee grounding. It doesn't hurt, and that if we reduce some of the pigment in our skin, like the unwanted age spots, liver spots, and broken capillaries, I feel like that definitely helps with anti-aging. It's my favorite treatment at the med spa.
Do you endorse red light therapy? Do you use that in the practice?
So we have one light that is red and blue light therapy. We like that near infrared, right? It needs to be medical grade. I feel like you can walk into Marshalls and buy a red light. It does not mean it's the same level. I think the studies that support that are great. They're just small. I know that New Life Spa has the red light therapy, and we like that. And then the Hot Spot Tanning Salon actually has a red light bed with the lymphatic drainage. I think that can be beneficial. Again, on some of those, I think that you've got to get some clearance and make sure you're talking with your provider and making sure they think those things are safe, right? And again, the number one thing that we could all be doing, and I should have started younger, I should have listened to my mom, start with my sunblock. Right? If we don't want to age, we're trying to avoid that nutrition or water, we're working out. But if you're getting into bed and tanning bed or out and we're overdoing our sun, we can't. At the end of the day, we can't reverse all the aging. That sun damage catches up with us.
So I know there's been this huge decrease in the consumption of alcohol, as people discover. I don't know why they're not reducing tobacco, which is equally as bad. But what is your take on alcohol and how it affects aging? You'll notice a trend here. How do I know? Do you think that alcohol, really moderate use of alcohol, is that also impacting this?
I feel like alcohol is definitely, I think there's a fun amount of alcohol, but as far as a safe level of alcohol in the aging process and all of our organs and mental health, cognitive function, I know it's not the fun answer, but I don't think there's going to be more risk than benefits. Fun sucker.
Okay.
Karen.
Peptides are all the rage right now. You see and hear about them everywhere. What are your thoughts on peptides? Like, is it science-backed? Is it legit? Should we trust that? Should we jump on board?
I think, and I'll let Tessa hit on this too, I really am passionate about that. And I can also tell you that Tessa and I know a little about some of the peptides. There are so many peptides out there that I think that you should be, one, going to a trusting provider. I think just because you can order it on the internet doesn't mean it's safe. I think that our pharmacies are 503A and 503B, which is state and federally regulated, need to be involved with that. Again, I think that's a discussion that you should have with your primary care provider too, just because, you could be buying Inflate-A-Flat and they're calling it a peptide, and that's dangerous. But yeah, I definitely think there are peptides out there. Tessa and I like the BPC 157. We're seeing some people who have joint pain, tendon and ligament issues. It helps with gut health and balancing. So I think there are some peptides that are great. I think it's hot and trendy, and I think you better know your stuff before you use them.
And we do, I'm going to add one more thing and then I'm getting to you, Linda, sorry. We do utilize a lot of like the GLP-1 compounded GLP-1 peptides and have a lot of success. Injectable, yes. For weight loss is what we're using them for. So the compounded version of tirzepatide and semaglutide. And so we've seen a lot of really encouraging success stories on patients using those and even for their benefits beyond weight loss, anti-inflammatory, even helps them sometimes with other things they struggle with. So if they are prone to want to drink their alcohol in the evening and that's kind of a habit they've gotten themselves in, they find themselves being like, we don't, care less about that. Or for me, snacking into the night. Don't care as much.
and OU and OSU are putting out some really good studies on mental health, substance abuse disorders that are all being improved with the use of GLPs. Maybe not the same dosing that we'd use for weight loss, but it's pretty exciting.
It is, and we definitely want to learn more about it, so stay tuned.
Well, you answered my question.
Oh, okay.
I wanted to know about the GLP-1.
Oh, okay.
Are you all involved with that or with your patients, or is that something you see coming in the door more? Just give us a little blurb on it.
So, in family practice when I was at the hospital, I was really excited when we had Ozempic and Wegovy and Mounjaro come out. I feel like Dr. Beck was probably in on this too. Before insurance companies were only covering it for diabetics, I had a few patients that they did everything. They tried everything for weight loss and still struggled. So I did it when we were doing brand name stuff in the family practice setting. When the compounded version started coming out, again, hot and trendy, and I think that where you source that is probably just as important as why you're taking that. I also see a trend with this. Again, you can pick up the phone, you can turn on your TV, it's on your Facebook ads, it's everywhere, and everybody is selling it. So safety is our number one concern, and it's not a one-size-fits-all, and it's something that you really need to be monitored on. Labs, kidneys, your protein intake, because we've seen those melted candles out there. Those are not our patients. Those are not coming from us. We talk about diet and nutrition and lifestyle, and the importance of long-term success with that, not just I have a cruise in 3 months and I will get snatched.
Dr. Bechtel, my might speak to this too, but I know the indications for your primary to order it would be type 2 diabetes,
Sleep apnea.
sleep apnea. Are we getting it covered for anything else?
Well, it covers for obesity, but still the co-pays are insane.
I think it's a wait and see what's happening. There's so many things going on with this current administration that are supposed to be bringing costs down that they promised. We just haven't quite seen it yet. But I saw last week where Amazon has it online for like $150. So it's a bit unaffordable for you and you're trying to pursue it through a clinic like this or your primary. It's going to be affordable sometime real soon.
Well, isn't that the benefit, like, if I get GLP-1 from you, because it's compounded, isn't that cheaper than if you are getting those name brands?
If you are someone who it is not going to be covered by insurance, then yes, yes, in most all cases. Yes, ma'am.
I'm seeing a lot of data now about how it works well for weight loss, but it can be very difficult to come off.
Yes. So there's not a, this is what I tell all patients because that's always the question when we're first starting our conversation is, what does this look like long term? And there's no set, like this is how we come off of it, this is how we manage. You know, we have had patients come off of it and we always encourage our patients from the beginning, use this time while you have, you know, appetite control, while you don't want to overeat, while you don't have all that food noise influencing you, to make good decisions. You know, get your body acclimated to wanting protein, to staying hydrated, to making good choices, because again, we don't have our brain working against us like we do off of it. And so I think the more the patients utilize those modifications while they're on it, makes all the difference for their success if they want to come off of it. So we have patients that have come off of it and done great. We've had patients come off of it and have gained weight. We have patients that will go from doing a weekly injection to every 2 weeks, or doing a much lower, or what we call kind of a microdose on a weekly basis. It just gives them that little bit of control that they need to maintain what
So
they...
you think as you titrate them down, how much of that is emotional and how much, and at some point they're going to get down to a level that isn't particularly therapeutic for weight control. Do you find that they still have that psychology of, I'm doing this, it's working?
So Tessa and I are, again, we're not dietitians, we're not nutritionists. Thank goodness we are pretty educated on that, but we always refer back to that. I also think that some of the studies out there are supporting, I know I'll use alcohol as an example, even a year off of being off that medicine, patients are, some of them are abstaining from alcohol totally, because it helps with that craving area in the brain too. So we've seen long-term success, but I feel like, again, if you're using it as a Band-Aid and it's super fun to lose weight and you're not making the modifications, I think your mental health and that psych part of it is going to be exactly where you started. And that's not a fun cycle. If weight loss was all the way, if it was linear and downhill, as soon as we started it, Tessa and I, we wouldn't be seeing patients and Dr. Becker wouldn't have diabetics. And it would be a great place for all of us.
It's our business, come on.
That's true.
I would be remiss if I didn't take the opportunity with the art of aging to rain on your parade just a little bit, and I will pay my fine. I have a book that I recommend to all my patients. It's in every one of my rooms. If you guys are my patients, you've seen it. I recommend it every year as part of your physical. It's called Younger Next Year. The subtitle, it was given to me by one of my 90-year-old patients, and I read it and I thought, oh, everyone needs to read this. Younger Next Year, How to Live Strong, Fit, Sexy, and Smart. That's the latest version of those data about mental health and fitness. Until you're 80 and beyond. And there's a women's version that deals with all the hormones and the things that you all do. It's a fantastic read. It's a short read. Younger Next Year. Recommend it to everybody.
Thanks. We're going to pick it up. We want to look younger and sexier and what?
How to live strong, fit, sexy, and smart until you're 80 and beyond.
All of the above. Thanks. Sign me up.
It's not a book about aesthetics. It doesn't say look younger, it says be better.
hit the red button.
Great job, great job, great job, ladies. Great job, great job. Wonderful information there. All right, next week's program is our very own Mary Richardson with Lindenwood Fairy Festival. So we look forward to next week's program telling us all things Fairy Festival. Thank you to Mulligan's for that wonderful lunch that we had. And now chairs and tables stacking the blue 8 high, putting out 7 metal. So if you will stand, we will adjourn with the full test. Of all the things we think, say, or do, is it the truth? And is it informative?
I got 2